Okay. Hello, good morning. I hope I can be heard. It's really good to have all of you join us. Let's just please give ourselves 3 more minutes, then we officially begin. Hello, good morning. Thank you for holding on. We've seen that some more people have joined. It's really good to have you all on board. My name is Georgette Panford Quenu, and I'm with Equity Health Insurance. Thank you all for joining us today. On behalf of Equity Health Insurance, I'd like to warmly welcome you to this exclusive webinar on our value-added health services. We are very excited to share practical ways that you and your colleagues can access very convenient healthcare through our telemedicine platform, drug delivery services, and the new CliniTouch app. I really trust that you find today's session very informative, interactive, and beneficial. Without further ado, I'd hand over to Kexi to give us the overview before our speaker, Benjamin, takes over. Thank you, stay tuned, and enjoy the session.
Hello, can everyone hear me, please?
Yes, please, we can hear you.
Good. Good morning again. I want to hear from our cherished clients. How is everyone doing, please?
My name is Clement. I am very well and good to be on the call.
Thank you, Clement. So this webinar is to enhance our service delivery and also continue one of our priority areas, which is engagement, to educate you and also to share a lot of information with you on how best you can utilize your benefits. We have this belief that it is not just about going to the hospital with the slightest headache, but it's about speaking to the right doctors. And that is why the telemedicine platform, the drug delivery platform, and our new initiative, the CliniTouch program, which manages chronic conditions to make them better and also reduce your medicine dosage or medicine intake, measure and also monitor whatever conditions you are on. So this engagement is to be able to tell you that this is what the telemedicine can do for you if you use it. Let me humbly say this. In the first quarter, every individual that took the opportunity to use the telemedicine platform did not have the cost to visit the hospital again. Now, what that does for you is that your utilization is lower, you have more benefits when you need them, and you get a personalized attention. So, for example, once you speak to the telemedicine, which we are going to go into it proper, we are able to do other follow-ups. The drug delivery is also able to deliver on time. And our new initiative, the CliniTouch Chronic Disease Monitoring Program, is to assist our patients who have some chronic conditions and currently are on medications. I would want to humbly say that feel free. We would be on standby for questions, and I would encourage you to share your questions also via the chat before maybe the presentation ends. We are happy to have you on this webinar this morning. We assure you that this information is going to be educative, is going to be enlightening, and it's going to give you a lot of assurance on our delivery, so that at the end, what we say we always do is to be here for you. Thank you very much. I would now want to hand it over to Georgette so she can continue to moderate the session for us. Thank you. And welcome once again.
Thank you so much, Kexi, for that overview. Without much ado, we are now going to hand over the baton to Benjamin Otu, who is the Senior Operations Officer for Equity Health Insurance, to take over. It's going to be an enlightening session, and I entreat us all to stay glued, participate, and read, take questions afterwards. Thank you. Over to you, Benjamin.
Thank you, Georgette. And as she mentioned, my name is Benjamin Otu, and then I'm the Senior Operations Officer at Equity Health Insurance. So today, I would like to welcome all of you to Equity, and thank you for choosing us. Thank you for joining this session with us. At Equity, we don't only want to cover your health, but we want to as well give you convenient and exciting ways that you can manage your health. So today we'll be talking about some of the added value services that we have that can help you manage your health. So we'll be talking about the telemedicine, the drug delivery, the chronic care management app that we have, and then the added value services that we also have concerning your claim management. So this is the table of contents. And before we go on, there are some that have joined who are not on our scheme yet, and I would like to welcome them as well. But then I want to let them know who we are as Equity Health Insurance. So Equity Health Insurance was an indigenous company which was established in 2017, and then it's one of the fastest growing health insurance companies that we have in the country. And for the past 2 days, our CEO, Dr. Elton Afari, won the best CEO at the health insurance, in the health insurance category at the CEO Summit, which happened at Kempinski. And we have over 50 years combined experience of staff. We have very much experienced staff who are always diligent at their fields to deliver for you. And we can always boast of having the quickest claim payments. And then we have a strong financial backing as well. We serve close to over 100 corporate clients, and we can also boast of having about 2,000 lives, 20,000 lives on our scheme. So without much ado, I will just start with the first one, a telemedicine. I will want to tell you about what it is and how it works, and some of the benefits that you have when you use the telemedicine system. So it's just a service that we offer you where you can talk to a doctor virtually, by video, or by call, by a phone call, without leaving your house or without having the hassle of going to a hospital. So in your home, you can just call us. You can just place in a request, and then we will do it. We start for you. We start the service for you. And studies have shown that a study that was done during the COVID period has shown that the satisfaction that people get when they go for the visits, the outpatient visits in the hospital, is the similar satisfaction they get when they use the teleconsultation. And this has also been proven by the checks that we've been having in our facility, the checks that we've been having in our company. So since we started the service, we have had almost all the cases, about 95 of them, seen through telemedicine, that they have not also required to go to the hospital after 3 days. So after every 3 days, when you do the telemedicine, we call you, find out how you are doing. So most of them reports that they are well and they did not need to go to the hospital for any follow-up. And I must say that this is not for emergency cases. Although on our scheme, we give you the chance to always call us when you're having an emergency so that we can arrange for you any accredited facility near you. But this service is not that. This service is not for emergency cases. It's not for cases where you are in extreme pain, cases where you are bleeding. So this service is not for emergency cases. And then it's very simple and efficient process. So I'll take you through the process. What happens when you onboard on this telemedicine service that we have. So for the benefit of those that are not on the scheme and are listening to us right now, I will talk about the payment models that we also have in the telemedicine. We have a telemedicine service that we give to people where it's 50 cedis per month. You pay and then you have 3 consultations for each month. So when the clients want the service, they talk to our call center, they call our call center lines or place the request on WhatsApp to the call center line. And then, so with the request, you have to tell us where you are coming from, your name, the company you are coming from, and your membership number. So we will always check if your policy has not expired. And for those that are joining us who are not on the scheme, so we always check if you are active, if the payment has been made, and then we'll place in the consultation, we'll book in the consultation for you. And within 3 to 5 minutes, you'll be called by a doctor where you talk about your medical history, what are your presenting complaints, meaning what is wrong with you. So after that, what's next is that if you need an extra care or if you need your samples taken, we also have the phlebotomy, the mobile phlebotomy. So the phlebotomist will come to where you are, take your sample, take it to the nearest lab for you, and then your labs will be done. And we will continue from there. But if there is the case that you don't have to do any labs, that's where our drug delivery system comes in. So I will go to the drug delivery when it's due. But then after the telemedicine is done, after the teleconsultation is done, we have the delivery system where your medications will be delivered to you in less than 180 minutes. So, like I said, if your complaint or if your service required that you needed to go to the hospital to do checkup, to continue with the care, our prescribers, the partner clinics that we have, they write a referral for you to go. And if you need the labs the mobile phlebotomy is there, you do the labs and then it continues from there. The review is being done. And after the review, your medications will still be submitted, will still be sent to you through drug delivery. And also, if you need a referral will be given to you to take to the nearest hospital. We'll also arrange for you if you need a referral to go to another hospital. So after 72 hours, after 3 days after you made the first call, we call you back and then ask you of how you are doing now. Currently, how the complaint is, if what you presented with has reduced, if it's getting better now. So you let us know, or if since after the telemedicine, you yourself decided to go to the hospital, you tell us. But this is where it is exciting because from all the people that we have seen through the service, the telemedicine service since we started, have not reported that they went to the hospital after they were seen by the doctor. So that means it's very efficient and is working as it's supposed to be. It's also effective, cost effective, because looking at going to a hospital near you to pay consultation for 150 cedis, why not rather do the telemedicine for 50 cedis, which goes about 50 cedis or less for you to get the same care and then the satisfaction that you need. And for this also, you don't need to be in a queue. It's very convenient. In 3 minutes, you get to speak to a doctor or you get to see your doctor's face. When it's a dermatological case where you need to show the doctor, you will have to, so we have the virtual calls as well. So it's very convenient. In 3 minutes, you'll be called, you speak to your doctor. It's efficient as well and it's effective. And for those that are on our scheme, it's part of, we do this also for you to be able to manage your benefits. The benefits that you have for the year, the average cost of care when you should visit the hospital and complete everything is about 450 cedis. But if you should use telemedicine, it drops to about 250 cedis, including medications and all. So I would advise that you use the telemedicine service and then manage your yearly benefits so that your benefits can last for the whole policy year as you prefer. You always get the appropriate care that you need when you do telemedicine. Your prescriptions, your tests can be done at home. It's convenient. It can be done in the office, your place of convenience for you. You don't need to always go to the hospital for it to be done for you. The next one that we'll talk about is the drug delivery system. When I started with the telemedicine, I talked about the drug delivery as well, where after the telemedicine, your drugs are delivered to you. The drug delivery is in two forms. We have the chronic medication supplies that we do to our clients each month, where we supply you the medications that you need. You send us your prescription, and then we will deliver the medications to you. We supply to you as you are always on the chronic medications. So both the diabetics and the hypertensives. You supply to them each month. All you need to do is send us a prescription. And it's worthy to note that anytime your prescription changes, you need to tell us, you need to inform us so that we'll work on it for you. I forgot to mention, sorry, we have correspondence in the chat box. So any question that you have, you can put it in the chat box and then our correspondents will respond to you over there. But when I'm done, there's a room for questions as well. So to access the drug delivery service, all you need to do is take a picture of the prescription that was given to you and then your active membership card. This, unfortunately, is not available for those that have not registered with us. But also with the partner clinics that we have, we can always do the drug delivery for you. So with the drug delivery system, to all the policy terms that we have with you is applicable. So after the drug gets to you, there is a form that you fill because of the quality control checks that we put in place for both the telemedicine and the drug delivery and all the services that we provide. We give you a form to sign. With the form, you have to confirm whether the medications that you requested for is the same as what has been given to you. So like I mentioned, the chronic medication supply. So you don't always have to go to the hospital to go for the checkup. I will speak about the Clinic Touch app, the chronic care app, where you know that you can talk to a doctor or a doctor can review you, see you in every 2 days. With the chronic care or the chronic medication supply, you send us a prescription and then we supply you each month. But in the case where you go to the hospital and then your prescription has been changed, the dosage has been increased or decreased by your doctor, you inform us, you let us know that your medications has been changed. So if that's the case, we start delivering the new ones that has been given to you. So with the same thing, the benefits is convenient. You can always receive your medications everywhere that you are. And also the acute medications. So I talked about the chronic medication supply, but the acute medications, let's say you did not use telemedicine. You did not use the telemedicine system that we have, but you went to the hospital and then you were given a prescription. The hospital was not able to supply all your medications for you. It's the same process. All you need to do is take a picture of the prescription and add your card to it, and then we will deliver. One thing is that because you are with Equity, we give it to you at a subsidized cost we have partner pharmacies that we work with, and then so the costs are always subsidized. And then this will help with your member utilization, and it's hassle-free as well. You don't need to always go to the pharmacy when you have the prescription to be delivered to you. So this is the last one, which is kind of a combination of the two services that I initially mentioned. In the Clinic Touch, you may have a kind of telemedicine inside. It's a kind of telemedicine software, not so telemedicine. All that you need to do is always answer your questions. When you go to the hospital, the chronic patients, the hypertensives and the diabetics, the questions that you are being asked each month, then whenever you go to the hospital, you will find this on this app, and then you answer them as you have to. So it's just a personalized software that's a digital health app where your doctor can monitor you remotely. So any doctor can be on it. You can let your doctor come on it and always monitor you remotely. But we also have partnered people who are always behind the computers checking on this for us. So every time the symptoms monitoring. So periodically, whenever you go to the hospital, let's say in a month, whenever you visit the hospital for checkup before your medications are being given to you, or the quarterly visits each 3 months, that's when you need to go, or each 6 months. For this, because of the symptoms monitoring in this app, every 3 days, all you need to do is log into the app and then answer those questions. The questionnaires are simple and short. So you answer these questions, and then your doctor will review your symptoms. So whenever the symptoms are showing that it's not good, you are below a red line or you are within the yellow, the doctor will place a call. You'll be called by someone, and then you'll be advised on what to do. So also you'll be tracking your vital signs. You input your vital signs. That's when you are checking when you want to only check your blood pressure, you'll be entering your vital signs every time. So the 3 days that you log in, every 3 days that you have to log in, is actually set per when you want to do it. So some clients do it weekly, some do it daily, some do it every 3 days. So when the day is up, then you have to enter your details. You have to monitor, we have to answer the questions about the symptoms. You have to also enter your vital sign. As you checked your BP this morning, what was the value? So after you are done entering your vital signs and then answering the questions about your symptoms, you have a remote clinical support, as in the doctor that reviewed you will reach you out and then speak to you about your health in the cases where it is needed. So whenever you are in the green lines, the doctor only checks on you every 2 weeks. But whenever it's needed that the doctor calls you, you'll be called as well. And over here, most of the people that we do the chronic medication supplies are on it. So we always check on them. The app also reminds you to take your medications. It's accessible on both Android and iOS. And one interesting and exciting thing about this app is that it's educative. There is an educational section where you can view things about your health, where you can learn about your health, about the condition that you have. Anyone can actually log in. It's not for only the hypertensive or diabetics. Everyone can actually log in. So it's educative. You can get stories, you can get your details about your health. You can also know how to use your devices in this app. So there are videos that you can read, there are articles that you can also see where you can always read and then know about your health. So like I said, some of them have their weekly health questions. So each week they are prompted to answer their questions. And then they submit their vital signs as well. And if you are reading the red and yellow lines, an immediate call is placed to you to check up and then advise accordingly. But when you are in the greens, your course comes each 2 weeks. So you may think that you are not being engaged, but I can assure you that every time that you log in your details, a doctor sees it and a doctor reviews it. So anytime that so let's say you go off track for about 2 weeks, or you go off track for maybe a week, you are being called, a follow-up call is being made, and then we want to advise you to stay consistent on it. So a follow-up call is being made to check up on you and see if you are well or not, and why have you not logged in. So this call is also to remind you to send us your details. So like I mentioned, the most of the review calls are done when your answers or your readings fall outside the normal range. And then your medications are also delivered as well. I would have shown some progress. We have videos and we have, because of time constraints, I cannot do that. We have videos and then stories of people who have used the app and then seen progress in it. Some started from the red and currently are in the green levels because they've always been consistent on the app and they've always been checked on and I adhere to the advices that was being given to them. And now they are in the greens. They are doing very well on it. So this is how you sign up. Always you have to sign up with us. You have to fill the form with us. We will sign you up. Then you download the Clinitouch app. You log in with the number that you registered with us, and then you get an OTP. So for those that use the iOS, let's say if you use the health app on the iPhone, you can link it to this app, and then all your readings can be seen from both ends. On all your progress can also be read from both ends. But in the cases where you do not use the health app on iPhone, all you need to do is choose manual entry. That means you'll be entering the vital signs yourself. You start entering your vital signs. There's a graph where it shows how your progress is actually also going. And then you answer the questions and that's it. You enjoy. So anytime that you open, you can find out the educative contents I talked about as well. Yeah, this is our customer support numbers. I'll leave it for about a minute so that you save them. So for those that are not on Equity, those that do not work with us yet and would like to work with us, these are our numbers. They are diligent. Whenever you call them, they pick up and then get your solution for you. So these are the numbers. I'll leave the slide on it for 1 minute so that you can save them and use them if you want. Okay, so these are the lines, and you can always call us or email us It's cr@equityhealthinsurance.com, and we'll get you sorted out. So one of the other interesting things that we have, that we do, is an added service, and we mostly do not talk about to our clients, but it's also important that you know, because you play a part in this as well. So we have some claim management interventions that we do. I do not know if any of us have received a call from Equity trying to inquire about what you did in the hospital, what was done for you in the hospital. So we have the call verifications where we call all the people that went to the hospital in the previous week. We check on them and then find out if what was submitted for them was what was done. So one of the things is we call you, we find out if you were detained. If you find detention inside, we ask you if you were detained. We also ask you if your blood sample was taken. You may not know what was done, but you can always confirm if your blood sample was taken or you gave your sample for some labs to be done. So kindly be anticipating our calls, and anytime that you receive a call from us concerning this, I would plead that you always be attentive and then give them the ear that they need, and help us to also help you manage your benefits well. We also have the claim verifications. We visit the partner hospitals, the hospitals that you have chosen that you'll be going to for healthcare. We go there and then check the claims that they submitted with the bills. So we do not check your medical records since it's confidential and it's for you. We only have to check the bill and then see if the bill is aligning with what has been given to us. And the last thing is that whenever you get a claim alert, so let's say you went to, I won't mention any hospital's name. You went to a hospital and then you've been given an alert that what you did is about, they are claiming about 1,002 from what you did. And know yourself, you only went there to maybe do a consultation. You didn't even receive the medications. You used drug delivery for your medications. But this hospital is saying that what you did is 1,002. So you can always call us, find out what was billed for you. This, in a way, is helping us manage your benefits and also help us to know who we are working with and how best we can protect our clients and protect your premium as well. So anytime that you visit the hospital and then you have gotten a claim alert, which is more than what you think you did, you can always call us and then find out the details. We'll give you the details of it. So all these services that I mentioned, all the talks that I did, is always backed by a high and a very strict quality assurance protocols to ensure that we are always consistent with what we are delivering, and we are always excellent in the delivering of the service that we have chosen to do for you. Like I began, Equity, we do not only want to cover for you, we also want to help you manage your health in the most convenient and exciting ways. I will end by also saying that our app is currently going under reconstruction, and when it's back on live, you can access the telemedicine and the drug delivery, and also the clinic touch through the app as well. Thank you, and I'll end here. Georgette to take over.
Thank you so much, Benjamin, for such an enlightening and insightful session. We are happy to take questions now, if there are any. Yeah, so if there are any questions or you need clarification on anything that has been mentioned in the presentation, we are here for you. Oh, there is a comment from Raymond. Oh, okay, his is more of a testimonial, highlighting how the drug delivery works perfectly well and the number of times he's used it at the hospital. Oh, thank you for your feedback, Raymond. We appreciate it.
Hello. So is it okay to also ask for your testimonies? Those of you who have used any of the services, the telemedicine, the drug delivery, maybe if you don't have questions, you can share your testimonies with us so that we know where we are doing well, so we can improve on it. Then we take those testimonies and also share with others who are happy to join us. Thank you. Hello, Mr. Mamata. Raymond, please, you can go ahead. I see your hand up.
Hi, Raymond here. Good morning from Reese and Co. Okay, so my
Great, great.
question is the telemedicine. Who are the people who provide the service? Are they medical doctors? Because we need to get the confidence that we are speaking to a very competent person. And what is also the privacy, since this is a conversation over the phone, how is the privacy handled? Then thirdly, when giving the referrals, most often the referral will be done on a hospital form. What do we tell the hospital that we are referred to? So for instance, when you are referred from a smaller hospital, let's say Coco Clinic to 37, they'll ask you which hospital referred you here. So in that case, since it's a tele service, what will I tell the people? Or I just mention, oh, it's a tele-service, which I think might be a little of a challenge to the hospital that is taking the referral. So how is that handled?
Hello, Benjamin and team. The medical team will take this up, please.
Yeah,
So
Mr. Mama,
Benjamin,
thank you for your question. So you first asked if it's safe. So when you are being booked for the telemedicine, we create an account for you in a hospital software where we keep your details. So it's always safe. And then the calls are always being kept privately between you and just the doctor. We do not have any other person listening into it. And then about the referrals, so we have a referral chat. I do not have a picture here, but because I know where you are coming from, we'll let the team share it with you. So we have the referral chat where we will enter your details. We will write as a referral and then send it to the nearest hospital or the hospital that you prefer. make all the necessary details for arrangements for you before you get there. So it's safe, and we always help you get to where you want to go with the referrals as well. We arrange when you have to go to a nearest lab if the mobile phlebotomy is not available, or if you need to visit the hospital, you make the referral and then give you a copy, a soft copy, and then send a copy to the hospital so that they start processes before you get there. Thank you. Yes, they are doctors. They are all doctors. So we have partnered Medcare Plus Clinic, and they have branches all across Accra, and they are all doctors. So the clinicians from Medcare Plus Clinic are the ones that have been doing all that we need to do. All that we do every time is to train them, retrain them on the customer service, how to speak to our clients, and all. Thank you.
Thank you, Benjamin. Raymond, I believe your question has been answered, or is there a follow-up? Okay, you're welcome, Raymond. Okay, there's another testimonial from Eva. Eva, yeah. Okay, so she's given a testimony about her telemedicine service, and she's commending how good the doctors are, as well as the pharmacies in providing medication and how fast the process is. Thank you so much for your feedback. We appreciate it, Eva. Are there any more questions, comments, feedback?
Hello,
Hi.
is everyone with us?
Yes, we
Yes,
are
we are
all
here.
here.
Oh, okay, okay. Yeah, the meeting, the room seems to be very quiet. I wanted to chip in to say, is it to say that it is good news, it is working for you, and so forth, we can fall on the Great Commission to say that may you go out to preach the good news of Equity Health to help us reach more people. For example, the Clinic Touch is not only for our dedicated clients, we are able to help others who are not on the equity card to be able to get onto the chronic disease management program. And the way our doctors do it, I must say, it's a beautiful thing. The way they call, the way they monitor, and the way they evaluate the feedbacks on daily basis is quite an exciting journey. And the feedback so far has been great. So we would want to plead with you that do not hesitate. We would also want to continue to assure you of our commitment to continue delivering these services to you. Mr. Raymond and others, please continue to recommend us to other companies so that you will not be sharing the good things alone. You share with them. You know, sharing is caring. Yes. So I think if there are no further questions, we'll pause a little to see if there are some questions in the chat, or if there will be any additional questions, then Georgette would wrap up to close us. Thank you.
Hello, for the benefit of those that are not on our scheme yet, The telemedicine service that we deliver for non-equity clients is 6 cedis per month, and you have 3 consultations for the month, and your medications will also be delivered to you free of charge. Yeah, James, I have gotten your question. So it's 6 cedis per month. So that's about 72 cedis for the whole year. And you get to enjoy telemedicine. Have the opportunity to talk to our doctors 3 times in the month. But this is for those that are not on equity. Mr. Raymond, this will be talked about later on. So contact Georgette. Georgette says contact her and then talk to her about the premium discounts and all that. Thank you very much. And we really appreciate it if you refer us to other people. Thank you.
Okay. Thank you, thank you, thank you. Thank you all so much for taking the time to join us today. It's been an awesome session. I believe you agree with me. We hope through this session, you've gotten a clear understanding of how our value-added service works and how it can make healthcare more accessible to you and then your teams. And a big thank you to Benjamin Otu. Thank you so much for educating us. And thank you to each and every one of you. I can see some familiar names here. I'm so glad you joined, and the unfamiliar ones too. It's so nice to connect with you. Okay, before I finally close, I think there's one more question from Abby. Hello, Abby. Benjamin will take your question, please.
Hello, Kexi. There is a question in the chat box. I believe you can help us with that one. Hello, Kexi. There's a question in the chat box for you.
Yes, I was typing to answer it, but I can take it here. So, Abby, yes. Equity Health in partnership with Cigna Global, one of the biggest health insurance providers globally, gives us access to be able to ensure people who can have access within the African sub-region, Europe, and India, within the Asian Pacific. Yes, so currently we are able to do that, where you can be able to get access to other African countries. However, there are few conditions around it. So is it okay if I may humbly ask if you can drop your number? I would pick it up and have a conversation with you on it. Thank you, Abby.
Okay. Yeah, so Abby, you could also send a private message to Kexi. Okay, okay. Okay, Abigail, I think okay, Abigail, I've seen your message. I know. Okay, Abigail, I've seen your message. I know who you are. So I'll share your number with Kexi. Yeah, yeah. Thank you, thank you, thank you. It's been amazing. If there are no further questions, I'd like to wrap up the session now. However, if there are any further questions or assistance, please feel free to reach out to us. We are always here for you to help. Thank you all so much for joining, and also Benjamin's classmates. I see some of you on. Thank you so much for joining. It means a lot to us. Do enjoy the rest of your day, and we look forward to connecting with you again very, very soon. Have a beautiful day. Bye.
Thank you.